So here's our step-by-step guide with what's going to happen on the day of surgery. So number one, let's start with the week before surgery. So during that 1 week before surgery, you've been walking every day for about 10 to 15 minutes or more if possible. Now, some people can't walk. If you can't walk, then you can do dumbbell exercises or even just flexibility exercises with the arms. The objective is that you need to just pump your heart a little bit so that your heart gets ready to undergo the surgery. Number two, you're following a low-fat, low-carbohydrate, sugar-free diet for about 7 days. That helps reduce the size of your liver and making access to your stomach much easier. Number three is that you've been doing spirometer exercises. Now, what's a spirometer? Spirometer is a device that we give to our patients before surgery and after surgery so that they can practice inhaling air. What happens is that because of the weight on their lungs, the lungs tends to collapse. And until and unless you don't do these spirometer exercises, the lungs don't expand. And once you've expanded your lungs, you have higher levels of oxygen in your blood before and after surgery. And that plays an important role in recovering after the anesthetic. So you've been doing this for about a week before surgery. The night before surgery, you stop eating and drinking 8 hours before surgery. But you are allowed to drink water and clear apple juice until the morning of surgery, which is about 3 hours before surgery. You arrive at the hospital and you have your admission process done. And after that, you enter your room where your nurse welcomes you, changes your gown, make sure your file is complete, and then transfers you to the preoperative area. In the preoperative area, you get to meet your anesthesiologist, the operating room nurse, and the surgeon one more time. We confirm everything. We go over a preoperative safety checklist so that to make sure that you have a safe operative journey. We transfer you to the operating room where you have your surgery done, and then you come back to the recovery unit where the nurses make sure that you're pain-free and you're recovering from the anesthetic. After that, we take you back to your room where you get to relax with your family, and we serve you with different clear liquid diets. A dietitian comes and visits you, make sure you are aware of the dietary plans that come ahead. You get to walk around, you do your spirometry, we give you pain medications, we switch you to oral medications, and then after a day or two in the hospital, you get to go home. Your dressings are all covered by waterproof dressings, which means you're able to shower. The wounds are really small. They don't have any stitches to be removed. Everything's underneath the skin that will be dissolved on its own. You come back to the clinic after a week. We make sure your wounds have healed up well. We discuss your dietary options or your dietary stages for the next few weeks and give you all the relevant information. And from there on, you're always in contact with us, with our expert dietitian, and with myself, as well as our support groups, so that you can have a healthy transformation.